Part 2. First, the onset of illness. This means the timing of the first symptoms, possible cause and exposure to inducing factors, as well as the mode of onset that is sudden or gradual. Understanding these factors will help assess whether the illness is one of deficiency or strength or cold or heat. For example, an illness that begins suddenly and lasts a short time is likely to be one of evil chi strength, whereas one that begins slowly and lasts a long time is likely to be one of deficiency. A cold illness usually follows exposure to exogenous cold, and a heat illness usually follows exposure to exogenous heat. Next, the characteristics of main symptoms. These include their location, nature, and duration. An understanding of these characteristics helps in the determination of the location and nature of the illness. For example, dull epigastric pain that is relieved by warmth and pressure suggests deficiency of spleen yang. Lumbar knee aches and weakness, cold intolerance, and cold extremity suggest deficiency of kidney yang. Next is concomitant symptoms. The characteristics of the other symptoms besides the main symptoms contributes to the differentiation of strength and deficiency and cold and heat nature of the illness. For example, suppose the main symptom is insomnia, if the patient concomitantly has palpitation of the heart, irritability, a red tongue with little coating, and a tread-like rapid pulse, the illness may be due to deficiency of heart yin. If instead the patient concomitantly is easily frightened, has a bitter taste in the mouth, a yellowish and greasy tongue coating, and a slippery and rapid pulse, the illness may be due to accumulation of phlegm in the bladder, in the gallbladder. Next, the course of illness. Knowledge of the course of the illness from its onset to its present state is essential to its correct diagnosis. It is necessary to ascertain whether the symptoms have worsened, lessened, or stayed the same, and whether the illness has taken an unfavorable or favorable turn. It is also important to know if the symptoms are intermittent, spasmodic, or steady, whether they have changed or remain the same, and if changed, when and why they change. Next, the previous diagnosis and treatment. It is important to know whether the patient has consulted another physician, what kind of examination he has undergone, how diagnosis had been made, and what medicine he has taken, and whether the medicine has been effective or not. Number 4, the past history. The patient's status prior to the development of the illness, present illness, is clearly the result of many factors. Among the most important of these factors are his previous illness and his general health. For example, a patient who has always been in excellent health is more likely to develop an illness of strength. One who has been in ill health is more likely to develop an illness of deficiency, but is also more susceptible to exogenous illnesses. Number 5, personal lifestyle and preferences. The areas of interest here are the patient's lifestyle, diet, hobbies, pattern of work and rest, general state of mind, and addictions, if any. These all have the potential to affect his resistance or susceptibility to illness. In the matter of diet, an unbalanced preference for a certain state or certain taste may contribute to the vigor or weakness of some visceral organs. Improper work and rest patterns of habitat may also contribute to the development of illness. Number 6, family history. It is especially important where a contagious or hereditary illness may be involved. In addition to blood relatives, the family history should include all members living in the same household. In some cases, it is even necessary to know about persons in the immediate neighborhood. Thank you for your attention.